Hi, I'm Dr. Phil Memoli, and our purpose here is to examine the philosophy of biological dentistry, what it is and maybe what it isn't. We're going to talk about biological dentistry versus technological dentistry. The use of technology without biology will not yield long-term health or health period. Biology refers to normal functioning of the body. The body knows how to perform its functions. Sometimes it just needs assistance. Technology, regardless of how the body wishes to perform, comes in and exerts its influence and may or may not improve the condition. For technology, some of the pros are that we get faster results and it costs us less money. Why isn't that great? Why isn't that the way to go all the time? Well, one of the reasons is it treats symptoms only. Generally, you're not getting any long-term health benefits. One of the issues is that there are a lot of doctors who rely only on technology. They may not be as skilled and versed in health, okay, and they're trying to get by with the technology aspect of it. In terms of biological approaches, one of the problems for the doctor, not for the patient, is that it's going to require years to acquire skills in it. So you're talking a minimum of maybe 20 to 30 years just to develop the knowledge and skills required to master biological therapies. What's the benefit of this? The benefit is that you're going to get long-term benefits. You're actually going to have a better impact on health. What's the downside? Well, the downside is that you're not going to see immediate results. It may actually cost more money. At the end of the day, what are we really looking for? What are our goals? Our goals are to live longer, be healthy, and have a better quality of life. Biological techniques are better for that. Technology is much better when you have an acute problem. That problem can be solved with technology, but long-standing problems require longer treatment plans. For each year that the condition may have been there, it may take a month of therapy, of biological therapy, to resolve it. So if you have a condition that's been going on for 20 years, it may take 20 months to eliminate this. But at the end of the day, you have health. When you look at a holistic practice, you might find holistic practices that are very technologically oriented. And as I said, you're not going to see long-term healing there. You're going to see them focusing on things like amalgam removal or biocompatibility. But in terms of, what a biological or a regenerative practice might offer, in the biological type of practices, you're going to see more focus on nutrition, and you're going to see a greater focus on regenerative techniques, which include acupuncture, homeopathy, herbology, and not at a beginner level, but more at a master level, okay, with a mastery of understanding. What is acupuncture, for example? Acupuncture consists of treating the meridians. Our body is composed of meridians, and meridians might be something that you can compare a body like a lamp. Okay, so if we look at a lamp, we see that it consists of the lamp, the light bulb, and the shade. Now, if for some reason the light bulb or the lamp doesn't go on, okay, we look at the lamp itself and we say, okay, this is the structure of the lamp, and it looks okay. Similar to getting a CAT scan or an MRI and the doctor saying everything looks fine. But then you turn around and say, but I don't feel fine. Something's wrong. Well, what's wrong? Well, with the lamp might not be plugged in. There's the electrical, the energetic component to it. Acupuncture plugs the lamp back in and gives us the light and gives us the energy. Most of the meridians in the body go through the mouth area. So your teeth are connected to different organs via the meridians. You could look up a chart. I have a chart on my website which shows the different interconnections between teeth and glands. And basically the bottom line is, what is the acupuncture system? It's the body's communication and healing system. If we are extracting a tooth, if we are removing a dental infection in the jaw, if we're doing any type of therapy and we don't reconnect the meridian, then we're not going to get true healing. We're not going to get the healing that the body needs for long-term health. Another consideration is nutrition. Whenever you ask anyone, how's your nutrition, you're always going to get the same answer. My nutrition is fine. People tell me they rather talk about their religion or politics or their sex life or how much money they have in the bank account before they talk about what they're actually putting in their mouth. Nutrition isn't really about handing out supplements to people and saying, take these before you come in. Supplements may be part of this, but it has to be determined that that's what the person needs through some form of testing. A lot of what people consider to be objective, like blood tests, the blood is basically a homeostatic organ in the body. The body will always maintain the same levels of nutrients in the blood. If you're low in calcium, the body's going to pull the calcium from the bones and it's going to pull it from the teeth so that it always looks good in the blood. So are blood tests good indicators of health? Unfortunately not. So we need other techniques. Acupuncture is one of those techniques that can be used both diagnostically and therapeutically. But getting back to diet can happen at various levels. At the cellular level, dietary treatment can be homeopathic. What is homeopathy? Homeopathy is nanonutrition, it's nanomedicine. Homeopathy basically allows you to have an immediate reaction. So instead of ingesting a certain type of food and waiting until the body completely processes it and produces it at the homeopathic level, okay, you can take the homeopathic and get an immediate result. So homeopathy is in essence bypassing the whole nutritional process. It could supplement for something that you cannot process and get into the bloodstream at the proper level. And homeopathy is basically the language of the cells, nanonutrition, nanomedicine. Herbology. Herbology is another thing that has a nutritional component to it and therapeutic component. What is the major level? Herbology is acting more at the blood level, okay? And it can act as an antibiotic and it has to be used judiciously. Homeopathy and herbology can be used effectively together with acupuncture, together with food therapy. Thomas Edison, he basically said the doctor of the future will only use food to heal people. Food can reverse degeneration. There is a good deal of research that shows that processed foods cause degeneration. The dentist, Weston Price, he went throughout the world. He studied diets of many cultures. He found that the diet itself wasn't the most important thing. What was more important and more significant was the fact that there was no processed foods being consumed. The higher the amount of real food versus processed food, the greater the health and vitality and lack of disease in that culture. Pottinger, he was a medical doctor. He did research on cats. He would acquire cats that were in a degenerative state that were given to him to be put to sleep, if you will. And he found that certain diets could reverse the disease and the aging that cats had had. And he consistently would get similar results. Diet can effectively be used with these other tools at a biological level, which means at a level which will take a little longer, but at a level that has long-term effective results. If you're looking for the short-term result, you might be better with technology. But one thing to consider with technology, this is a statement that has been repeated over and over, but I practice in a town where Bell Labs exists. There were a lot of inventions made here. Engineers have repeated to me over and over, whenever technology gives you something at another level, it takes something away. Something to be considered. Again, consider biological dentistry, its pros and cons. This is Dr. Phil Memoli. Thank you for listening.